Cancora. As we all know, a swift, effective and fair vaccination programme is essential to deal with the pandemic, which unfortunately has been with us for more than 12 months. And as we all know, it continues to cause untold hardship in so many ways, right throughout this country and indeed throughout the world. I have to say that speaking to people aged over 80 and other frontline healthcare workers who have had the vaccine, it has been transformative. And it's heartening to speak to older people to see again the confidence that they've regained in themselves and hoping to get out and get back to a more normal type of life. We're all very glad to know of the very effective results of vaccines, and that's clearly demonstrated by the dramatic reduction in infection rates in those groups who have had the vaccine. So it's clear proof of the value and the efficacy and the absolute importance of getting the programme rolled out as soon as possible to all persons who are entitled to the vaccine. The recent changes announced by government on Tuesday night to the vaccination allocation strategy is causing concern to many personnel providing frontline services. On different occasions in the Dáil and through representation to Minister Donnelly, I had raised the need to prioritise certain frontline workers within the vaccine programme. In those instances, I had made representation on behalf of Gardaí, teachers, special needs assistants and also carers. The change to an age-based approach must be fully explained to the representative organisations of these frontline workers. And many of those people whom I've spoken to over the last 36 hours, they put forward very legitimate cases for prioritisation, and they need answers. Those personnel had expectations of getting the vaccine based on their prioritisation pertaining to their work being essential and oftentimes being based in crowded settings. So, Minister, I would appeal to you to outline why the change in strategy. I know it came from the Immunisation Advisory Committee, but it needs to be clearly outlined why this is seen to be a more effective approach and a fairer approach, and one that will deal with the concerns of the community at large. Thank you, Cancora.
Minister, you have 40 seconds.
Thank you, Cancora, and can I thank the Deputy for his question and his statement. The answer is that NIAC looked very carefully at all of the evidence to date, including new information which they didn't have when they came up with the original provisional prioritisation. And as the Deputy will be aware, for example, NIAC have shown that if you compare the risk of death from COVID between someone between the ages of 20 and 35 and someone 60 to 64, the 60 to 64-year-old is 70 times, actually more than 70 times more likely to die from COVID. Age is the single biggest predictor, and the prioritisation from NIAC and NEFIT has come to government on the basis that this is how we minimise the damage of COVID in the quickest time possible, saving as many lives as possible, and allowing us to open up the country as quickly as